Hi, everyone. My name is Kate Ormiston, and I'm the Anti-Trafficking Coordinator at the International Rescue Committee in Phoenix. Alicia, do you want to go ahead and introduce yourself?
Sure. My name is Alicia Winchell, and I am the anti-trafficking caseworker at the International Rescue Committee in Phoenix.
We're going to talk a little bit about COVID-19 and serving foreign survivors of trafficking. First, I just want to talk briefly about the International Rescue Committee. The IRC is a humanitarian organization that works worldwide to address humanitarian crises. The IRC was founded in 1933, at the request of Albert Einstein, and the Phoenix office was started in 1994. Our anti-trafficking programming is housed under the Health and Wellness Program at the IRC in Phoenix. We serve victims of crime, survivors of torture, and victims of trafficking, as well as asylum-seeking families. We serve all of these clients under clinical therapy and intensive case management services. The IRC and Phoenix anti-trafficking programs have two different areas. We work in the Arizona League to End Regional Trafficking, which is called our ALERT program. And through the ALERT program, the IRC provides comprehensive case management services to foreign national victims of trafficking. And then we also facilitate the CAUSE Task Force. This is the Central Arizona United to Stop Exploitation Task Force. Through this task force, the IRC partners with service providers and law enforcement and other government agencies to provide services to victims of trafficking, both domestic and foreign, as well as facilitate investigations and criminal prosecutions. I want to talk about some of the challenges that the IRC has identified in working with foreign victims of trafficking. One of the first ones that comes to mind is that there's often a language barrier. Many of our clients don't speak English as their native language, and serving victims who are not proficient in English can be challenging. We have learned how to utilize interpretation, both in-person interpretation and telephonic interpretation, to be able to bridge that barrier, but it can still be difficult in talking about challenging things for our clients through interpreter services. The next challenge I want to touch on is that many of our clients don't have immigration status or they have expired status. And this kind of leads into our next point. Many clients who don't have status don't have access to the same services as people with status or citizens, but it also leads to a constant fear of deportation. And this can make it difficult to serve victims because of the lack of resources for people who are undocumented. And then that fear of deportation leads into distrust and fear of law enforcement. This is challenging because we work with law enforcement because in order to facilitate investigations, but it can be difficult for victims to come forward when there is a fear of law enforcement. And many of our clients who are foreign victims are people of color. Next, oftentimes people who our foreign victims aren't aware of rights and laws in the United States. And this can make it difficult for victims to be able to identify themselves as victims of trafficking. And it's difficult for people who are from another country where laws and rights are different and then come to the United States to be aware of the protections that they have here. And as I said, this is one of the reasons it's difficult for victims to self-identify. And some of the other reasons that victims don't come forward is that fear of law enforcement and lots of other factors like threats and other control measures that traffickers use against their victims. So next, I'm gonna go ahead and hand it off to Alicia, and she's going to start by talking about eligibility for services and status.
Yes, so that last one on here as a challenge that our clients face is that they're not eligible for many services due to their status. And that's just something that I really want to highlight, because it's not only an issue that we face on a regular basis, but that's been especially challenging during this time of COVID-19. So most of our clients, due to that lack of status, are not eligible for employment authorization, and they can't work legally. So at this time, that's been especially difficult for our clients when most people are out of work anyway. So clients having to work these odd jobs is putting them more at risk, not even their health, but also the risk of being trafficked again. Following along with that, finding housing without proof of income, not just that without proof of income is difficult in and of itself, but right now when a lot of people are facing housing insecurity, that is something our clients as well are facing right now. And then not being eligible for public benefits such as food stamps, access, cash assistance. And then in the time of coronavirus right now, when people are getting things like the stimulus check or the CARES Act or rental assistance through the state, our clients don't have access to those resources. So Kate, if we can go to the next slide. I'll kind of rewind and talk about how our policy changes have happened due to COVID-19. So back in March, we did shift to remote work and our offices did close. We are working entirely from home and have been for the last couple months, and that has not been easy, but we've all been doing it together. Our focus has shifted more so from before, when we were able to kind of work with clients and address all of their needs. Right now we're focusing on clients' emergency needs and triaging from there to make sure that we're getting those highest needs met, because that's all we're really able to do during this remote work time. And then also there's not been a slowdown in referrals at this time. So we have established a wait list, and we're triaging in the same way that we're triaging with our enrolled clients. We're kind of going through our wait list in that exact same way. Next slide. Okay, for adaptations, we are providing services virtually and by phone, sorry. So that has been very interesting shift for most of our caseworkers who are very used to meeting with clients face to face. It's easy to go to their home and do a home visit, come into the office. A lot of our clients, due to the inability or the language barrier, that it's more comfortable to come in the office and meet with us there. So we've really shifted to just doing everything over the phone, which has meant a lot of relying on our interpreter line. And then also that's had a large shift in terms of our enrollments and intakes that we are now having to do via Zoom or via phone if our clients don't have that access to the technical resources. And then we have shifted our focus onto housing and food distribution. That's where we've found the highest insecurity. So in terms of housing, a lot of our clients have faced housing insecurity in that they've not been able to make their rent every month. So focusing on how we can provide them with rental assistance if they do feel like they need to move at this time, figuring out how to help them move when we're not able to come into contact with them. And then same with food distribution. A lot of our clients are facing food insecurity. So if you look in that picture right there, you can see all of us with our masks and our gloves on. And so we've been really mastering doing distributions of food with no contact. So that's kind of looked like giving our clients heads up and leaving it at the door, and then calling them after to make sure that they know it's there, it's not sitting out in the heat here in Arizona. And that way we're able to get them food without having to put our clients at risk and not having to put staff at risk as well. Connection to food banks, we are able to get our clients connected through there. That's been a little bit difficult because of transportation issues at this time, but it is noted there that we do have a partnership with Uber, so we've been trying to utilize that as well in terms of getting our clients to food banks and appointments that they need to. And then gift card distribution, it works in the same way that our food distribution has worked as well. that we're able to do those non-contact deliveries and still get clients the resources that they need. Next slide. I believe that was it for us. Oh, just kidding. So last thing is we have some recommendations just based on what we've experienced so far. And so what we've realized most important, not only for our clients and also for staff during this time who are also experiencing hardship working from home, is that it's so important to triage clients' needs. So what that's looked like is just we call clients and they're aware that at this time we're not able to help with, not that we're not able to help with, but right now the most important thing is to address those emergency needs. So those clients that aren't able to pay their rent, those clients that are in need of financial assistance or food, we are working on getting those done first. And clients that need things such as like ESL classes or GED classes, those are kind of taking the back burner. And then it's the same thing working through our wait list as well. So we make sure those clients that are on the wait list, we're able to get the ones that are having the most urgent needs at this time. Those are the needs that are being addressed first. And those needs are discussed in our staffings that we have pretty bi-weekly, I would say, just to keep tabs on how everybody's doing during this difficult time. Our second recommendation is just to remember that the trauma of the pandemic can be very triggering for our clients who have already experienced a lot of trauma. And so communication and support is very important for them. But it became very evident to me when the Black Lives Matter protests are happening and the curfews are instated, and just really having to check in with clients during that time too, to make sure that they knew that it was important to stay home at that time, but to make sure that there wasn't some trauma coming up from that as well. And then lastly, we just want to recommend that, or remind people that clients are in need of support in their language. So when that was more available in the office and we could bring interpreters in person, it was very different. And over the phone, it may seem easier to just try to get through the conversation. It's always so important to remember to call our interpreter line and make sure that clients are able to communicate in their language to us and be able to effectively communicate their needs and their anxieties at this time. And that is it for our presentation. So there is Kate's contact on there as well as my own.
Hello, everyone. I am Sarah Kent, and I'm a Human Services Planner for Maricopa Association of Governments and the Maricopa Regional Continuum of Care. This presentation will cover COVID-19 and the impact on LGBTQ victims of exploitation. Let's get started. This might not be news to you, but LGBTQ people are at both heightened health and economic risk for COVID-19. In March, the Human Rights Campaign released a research brief highlighting how the lives and livelihoods of lesbian, gay, bisexual, transgender, and queer community are particularly at risk of COVID-19. That brief found that LGBTQ people are at both heightened health and economic risk of the virus, as they are more likely to work jobs that are in highly affected industries, often with more exposure or higher economic sensitivity to the COVID-19 crisis. They are less likely to have health coverage and more likely to smoke and have chronic illness like asthma that can significantly increase their chances for infection. LGBTQ people are at increase of experiencing homelessness and in turn an increased risk of COVID-19. The well-documented, sadly inevitable increase of interpersonal violence, which occurs during pandemics and community crisis, also increases the likelihood that LGBTQ folks will experience homelessness and in turn an increased risk of exposure for coronavirus. Research shows that queer people are more likely to leave their homes and as a result become homeless due to conflict and safety concerns around their marginalized identities. Public health professionals are urging folks, as well as some governments have ordered people to shelter at home to help disrupt the spread of the virus. For people who are experiencing homelessness and housing instability, Complying with those directives is difficult, if not impossible. So compared to non-LGBTQ people, LGBTQ people appear to be more likely to face housing unaffordability and more likely in turn to face homelessness. As we know, there is an overrepresentation of LGBTQ young people in the homeless system. According to a recent study from Chapman Hall at University of Chicago, right off the bat, these young people are presented with an uneven playing field. It's estimated that about 7% of youth in the United States are LGBTQ, whereas 40% of youth experiencing homelessness are LGBTQ. Now, I'm going to add the intersectionality of race and ethnicity. From the United States Interagency Council on Homelessness website, an article titled "Centering Youth of Color and LGBTQ Young People, an Effort to End Homelessness," it says that young people experiencing homelessness are most likely to be African American, Latinx, lesbian, gay, bisexual, transgender, and or queer. Among racial and ethnic groups, African American youth were especially overrepresented, with an 83% higher risk of having experienced homelessness than any other race. Considering LGBTQ folks of color, adding that intersectionality into the mix, according to the CDC, or the Center for Disease Control and Prevention, the effects of COVID-19 on health and racial ethnic minorities is still emerging, of course. However, current data suggests a disproportionate burden of illness and death among racial and ethnic minority groups. So let's hone in on youth for a moment. As we continue to gain more insight from research studies from around the US and around the world, as well as in our own backyard at ASU through the Youth Experiences Survey, we know that traffickers create relationships that affirm a youth's identity and provide access to vital resources like housing and offer false acceptance and support. In other words, grooming, right? Traffickers often target LGBTQ youth for recruitment into sex trafficking by appealing to their experiences of rejection by family and society. And of course, using readily available social media, whether it's a computer or through their phones. Although youth and younger adults are estimated to have the lowest mortality rates from COVID-19, according to the CDC, they're not immune to its consequences, of course, including and is not as it relates to mental health and well-being. Even prior to the pandemic, LGBTQ people have been found to be at a heightened, significant increased risk for depression, anxiety, substance abuse, and even suicide. Because of all the stay-at-home mandates, heightened tensions with family can impact LGBTQ folks and youth who often rely on interactions with affirming peers, mentors, providers in schools, community centers and settings. So queer folks and queer youth are not strangers to tension or violence within the home, and they are more likely to experience sexual or physical abuse and be removed from the home for those exact reasons. And you can see here Amit Paley from the Trevor Project, he's the CEO. He says, for a lot of LGBTQ young people, the main source of support they get are from at their schools, in clubs and community centers and physical spaces that they now, due to COVID, have no longer any access to. So the crisis hotline has seen nearly twice the level of young people reaching out. Because of this pandemic, LGBTQ young people are not sure where they can turn for support. So there's an increased need, and sadly there's decreased services right now with COVID-19. And with COVID-19, it closes many support systems for homeless folks, for LGBTQ folks, for victims of exploitation, who mostly seek shelter and services from mainstream or non-LGBTQ specific agencies, such as community centers, drop-in centers, clinics, etc. Many emergency shelters and mental health clinics have resorted to virtual or phone intakes with very limited hours and very limited shelter capacity. So let that sink in for a moment. And recognize the folks that you have in your life and the clients that you serve. Here are some hotlines and resources that can help them out virtually. Feel free to take a picture. And then these here are some youth-specific resources. And the one at the bottom here is local as well, 1 in 10. These are all the sources that I cited in this presentation. And I know that this is virtual and you can't exactly ask me questions right now, but I am available via email at skent@az.mag.gov. I thank you so much for your time. Thank you for listening. And please reach out if you have any questions. Thank you so much.
My name is Angela Solomon. I am the Victim Services Co-Chair, as well as a Director of Programs at Streetlight USA. And today I'm going to be presenting on responding and adapting to COVID-19 related needs to ensure continuity of care. On behalf of Streetlight USA, we are sharing the responses that we have put in place to adapt our policies and procedures amongst COVID-19. Streetlight USA was established in 2009 as a residential program to provide services for adolescent females who have been victims of human trafficking. The purpose for adaptation amongst COVID-19 for our policies and procedures was first and foremost to ensure continued services to our clients, keeping in mind that the impact of trauma from human trafficking does not stop due to COVID-19. How we provide continued services to clients is by ensuring that our policies and procedures are focusing on continuing communication and information sharing, ensuring the physical well-being of our clients and our staff, ensuring the emotional well-being of our clients and our staff, as well as ensuring compliance in order to continue to operate and provide services. The additional how to our process is through what we call informed hows, which is rapid response to COVID-19 driven needs based on scientific and empirically based recommendations from the Arizona Department of Health and the Center for Disease Control, as well as ongoing adaptation. It's an ongoing process as the growing knowledge of the virus transmission and best practices for prevention, protection, and disinfection become available. We also take into account state and federal mandates and relief efforts to continue informing our policies and procedures as we continue to provide services and support our staff. So again, our focus for our policies and procedures adaptation to COVID-19 have focused on our ability to continue our services amidst the virus. We have focused our procedures on ensuring that our communication and information continues, ensuring the physical well-being of our clients and our staff, ensuring emotional well-being of our clients and our staff, and ensuring compliance so we can continue to operate. I want to start by touching on our first area of focus for our policies and procedures, and this is through communication. Keeping our clients and staff up to date with new information, mandates, resources, and how the organization is responding in a timely fashion is crucial. By providing this timely and ongoing communication, this relays the message to the organization that we take everyone's well-being seriously and that we are responding rapidly to the growing knowledge in our field. It also provides a sense of safety and trust to clients so that they can focus on their healing, and to staff so they can focus on client services. One such example of the adaptations that we have provided in our policies and procedures in relation to keeping our team informed is routine team emails from our business and HR department. You will see an example of this on this slide. It contains our continued efforts for ongoing transparency, while at the same time ensuring that there is confidentiality for all. We provide any pertinent updates related to the virus and how it impacts our services, our residents, and our staff health and well-being. And we reiterate the actions and the recommendations, the rights that our staff has, any recommendations on next steps, what to expect from Streetlight, and just reminders of our commitment to keep everyone safe and their well-being at the forefront. In the area of information, we also have remained connected with our volunteer and community partners, checking in with volunteers and community partners to share information about how we are responding to COVID-19. We are encouraging questions, requesting information from our community partners and volunteers. We're getting creative and sharing these creative ways of continuing services such as Tele-Services, telehealth, telepsych, and we're collaborating ongoing with our partners. We seek to remain open and anticipate needs of the clients and their support systems. Part of our updated policies and procedures include reaching out to our clients and families to, again, share information just like we do with our community partners and volunteers about how we are responding to COVID-19 as an organization. We also encourage questions from clients and their support systems. We are prepared to share our policies and procedures to help them feel more secure, and we've developed friendly guides for new systems and procedures that family members and clients can easily understand and follow. This slide presents a sample of our Tele-Services guide. It is meant for loved ones and support systems for the clients. It explains in detail the need and the benefits for Tele-Services during this time. It also anticipates any questions they might have and provides information. It reminds them that this is an additional form of continuing connection with their loved ones as they continue their healing process. It also guides them through potential technology-based questions. The actual form or the actual guide will be made available to you through a separate link at the end of the presentation. One of our additional areas of focus, in addition to information and communication, is ensuring the physical well-being through our policies and procedures. Our initial work early March with responding to COVID-19, we have implemented health and exposure questionnaires for our staff, for our volunteers, for our visitors, and our clients. We have updated these questionnaires based on updates by the Arizona Department of Health Services and the CDC recommendations. We have also developed trauma-informed confidential procedures to report potential exposure and receive support. We feel this is a very important component for staff to feel safe to report without feeling like their jobs might be in danger or that children might be treated differently if they were to report symptoms. We encourage them to report the symptoms. We remind them that they will have support moving forward. And this makes it a much safer space for them to report any potential exposures, concerns, or questions. We have also implemented environmental precaution measures that I will present in further detail in the following slides. This slide presents an example of our screening questionnaire for our personnel. We request that staff complete this questionnaire prior to coming on to campus, and that there is a recheck of body temperature at the time that the staff member has arrived to campus with a witness signature. And we have each staff provide this at the beginning of each of their shifts. This includes direct staff as well as administrative staff. The physical well-being has also been addressed in our client health checks. So in response to suggested updates to Article 7 for health institutions, we have gone above and beyond and applied this to our programs. Our programs are, one being a group home and the second being a behavioral health residential facility. However, again, we have gone above and beyond to implement these additional requirements that have been suggested to be adopted into our procedures in order to ensure the physical safety of our organization. This is an example of one of the health checks procedures that we implemented with our clients, with ongoing checks of temperature and questionnaires about any potential symptoms. The questionnaires for health symptoms are updated based on updates from the CDC as well as the Arizona Department of Health. Again, this is a rapidly growing area of knowledge, and we are staying vigilant of any updates on symptoms that might be added to the symptom list, any variances by age, incubation periods, things of that sort. And we update our forms as these updates become available. We have also updated our visitor policies, and these again as well continue to be updated as the guidelines based under the Arizona Department of Health and the Department of Child Safety are updated for our specific programs. Such an example would be that initially visitors were asked to refrain from coming on campus initially, and since then there have been updates indicating that visitors can resume on-campus visits. However, screening of those visitors has remained in place to make sure that we do not have sick individuals come and expose clients and staff. The televisits were implemented initially and remain in place for anyone who would opt to provide, to engage in visitation via televisits. Our environmental disinfection and cleaning protocols further support our physical well-being focus. Again, this is based on the suggested implementation provided on March 27th by the Arizona Department of Health. We implemented these disinfection and cleaning procedures in order to ensure that our spaces remain clean and the spaces remain feeling safe for clients and staff to utilize and enjoy. The procedure includes detailed shift checklists that ensure all frequently touched surfaces are cleaned regularly. It also includes the implementation of additional higher professional cleaning company to come in and clean routinely for deeper cleaning in addition to the staff cleaning procedures. We've enlisted the action of each staff member and clients to clean any surfaces they may have touched or shared, touched in shared spaces, such as class desks, sensory areas and items, yoga mats, and meeting rooms. We have also posted signs throughout the facility as reminders and guides. The emotional well-being through this process is also very important to keep in mind, and it's one that can easily be forgotten as we are trying to ensure physical health. However, we know that the emotional impact of COVID-19 is significant, and Streetlight USA prides itself on being trauma responsive, trauma informed. So we made sure to incorporate the emotional well-being in the way we adapted our policies and procedures for the situation. We did so by ensuring that we were providing support to staff to help them cope with potential exposures, possible need for time out of work, and also to help and provide support during their stress related to childcare or any financial burdens. Clients have also been supported through this process by ensuring that their services continue, that connection with their loved ones and families remain intact, and that we maintain a level of engagement that helps them distract from facts such as the restrictions out in the community, the decrease in available recreational activities in the community that oftentimes are part of their main coping strategies. The emotional well-being of our staff has been addressed by continuing our staff luncheons once a month. We modified them from all staff luncheons once a month to now we have broken up a day out of the month where we have repeated mini meetings for up to 10 staff members. So any updates on our program, on the community, on COVID, on future plans is shared repeatedly for each group of 10 people. We feel that this is important to keep the morale going and to help them feel a sense of normalcy. We have ensured leadership presence by alternating leadership that's on campus and gradually increasing the presence of all leadership on campus. We wanted to convey a message that we're not leaving them alone to handle the direct care services, that we are there with them, present and available as needed. As you can see in one of the images on this slide, we engaged in ordering swag gear for personal protective equipment to show not only the organizational spirit, but also to further encourage the use of personal protective equipment such as face masks. We also ordered swag gear that is that has stress tools in it, stress balls, things of that nature for staff to utilize to further help them cope through the increased stressors during this time. We have provided regular reminders of our employee assistance program and have encouraged staff and reminded them that this is a confidential service provided to them through our employee assistance program support link. We have increased our self-care emails, which were already in place prior to COVID as a trauma-informed organization. However, we increased them to address additional potential questions, providing a platform to share scientific, empirically based information to our staff, to ensure that they are making decisions based on sound data. We are providing them, again, education and relief resources for this information. We're providing fact sheets on our staff break rooms for COVID-19, and we're also providing any information that might be helpful to them as far as national relief resources that they might not be aware of and might be useful for their families. In addition to this, we have provided private and confidential support for any financial hardships any one particular staff member may be going through at this time. So we acknowledge that although our staff members have been able to continue work without disruption, we acknowledge that some of their family members in their household may not have the same ability to continue to work, and we want them to feel safe to come to us for any needs that they might have that we might be able to help with, such as food boxes or any financial support that we might be able to give. And lastly, we have looked at each case as time has passed independently to ensure that each staff's individual needs are addressed and that we can provide fair, remote, and flex hours if any particular staff is struggling with childcare needs or may be isolated, not presenting with symptoms, but could potentially be continuing some of their work remotely while still ensuring confidentiality of our client records. Our clients' emotional well-being has been addressed by, again, ensuring that services continue, by addressing the prior focus areas that we have reviewed up to now, as well as getting creative with how we replace services we may have lost, has made it possible for us to ensure that their emotional well-being and their healing services continue. As a result of COVID-19, one area of impact for Streetlight USA in particular has been a significant loss of our volunteer-based services. That includes group-based supports or group-based classes that we've needed to get creative with and develop alternative ways of still continuing those services. We have done that by collaborating with our community partners, volunteer groups, to provide web-based classes. So it could be web-based trauma-informed yoga, it could be healthy relationship classes online, things of that sort. We have enhanced our sensory rooms as well as our indoor and outdoor recreational equipment. This was one action we took at the very beginning because we saw the restrictions from the community-based activities that they would have available before this, and we knew that this could potentially be a re-triggering factor for them, reminding them of past traumas of isolation, control, restriction. So we wanted to make sure to provide them various outlets within the campus that were safe, that could continue to encourage them to engage in a social manner. We've also been sensitive to any triggers that the use of personal protective equipment might have on our particular client base. Considering that we focus on human trafficking and sex trafficking specifically, face mask was something that we had to address that was very specific for our population. The last, but definitely not the least important of the focus areas that we've addressed in our adaptation of our policies and procedures for COVID-19 has been to remain compliant with not only our licensing standards, but also our standards of practice, remaining vigilant of any updates for our type of programs, remaining informed on standards of practice and temporary allowances, and researching best practices for our services during global level situations. As mentioned before, Streetlight USA made the decision early on to go above and beyond by implementing the suggested adaptation of specific procedures to ensure the well-being of our staff and our clients. We developed the Communicable Disease Precautions and Protection Manual that is made available and is user-friendly to enhance protection of residents and staff. This manual consists of step-by-step information related to health screenings, environmental setup and maintenance, as well as proper use of personal protective equipment and proper cleaning and disinfecting methods. So this manual provides additional details to what you see in the environment and what you see being communicated in our emails and in meetings and in our staff monthly luncheons. Our CDPP manual, again, consists of levels based on situations of potential exposure. It also provides step-by-step procedures on setting up isolation rooms or recovery rooms. Like I mentioned before, proper use of personal protective equipment, the proper cleaning, resource pages for these two as well, and links, a link to the Environmental Protection Agency's end list of COVID-19 approved disinfectants. There is also a section on optimizing PPE that has been updated based on the availability of PPE, but was initially developed in response of the limited supply. We also provided visuals. As a trauma-informed organization, we believe that information needs to be presented repeatedly and in several ways, and one of them is through visuals. And so we provided examples of that in case they need to address such a case. If their stress response is activating and they're having trouble reading the information or the steps, they can look at the images. Our manual is, again, levels-based. Orange level is used to identify residents within the initial 24 hours of pending medical examination in response to confirmed body temperatures of 100.4 degrees or higher, and any confirmed or endorsed respiratory symptoms that we feel a medical provider needs to address and provide further information on how to move forward with the client in this situation. Our red level is utilized when a resident's medical provider has indicated the need for ongoing distancing while recovering from a suspected or confirmed case of COVID-19, not requiring hospitalization. Again, Streetlight USA is a residential facility for both programs, so we felt we needed to be prepared and think ahead in case we did have one of these situations. Each level also provides, like I mentioned, images of the PPE that will be needed, where to find it, and how to use it. Step-by-step procedures for these. It includes a section on precautions for each level, such as the distancing, the specific disinfection procedures or equipment to be used, not only on the person, but in the environment, such as biohazard bags and the such. Here you will see an image of personal protective equipment for orange level that includes a list of what you should find in the baggie with all of the personal protective equipment included, as well as an environmental kit that relates to that level. So you have a kit for the person and you have a kit for the environment. Again, compliance really works when you remain informed. We encourage frequent check-ins with licensing authorities. Review your contracts and any special considerations that may be available given the global situation. Check in with professional licensing boards for temporary adjustments to practice guidelines, such as licensing and supervision requirements for clinical services, telepsych and telehealth. Any changes, temporary changes to professional liability insurance requirements for telepsych. And look into exemption requests if you are struggling to meet certain requirements for clients. Your clients and services do not have to go without. There are a lot of resources available. The link below shows one example of an exemption request through the Arizona Department of Health Services for certain services that might not be available. We encourage you to be diligent and continue to look for such resources so that we can continue services to our clients. Best practices in the field of human trafficking is an ongoing and growing process. So this is no different in relation to how we address COVID within our population. Continue to attend trainings online. There has been a notable increase of trainings available online that you can take advantage of. We do not have to sit still. We can continue to learn and to adapt to these real-time issues. Communicate with community partners serving trafficked populations, share information, share procedures such as what we're doing today, help one another in order so that we can continue to provide services to human trafficking populations throughout the state. Engage yourself in frequent literature reviews of peer-reviewed articles. These are still coming up day to day. Again, part of the growing process, whether they're specific to human trafficking or COVID-19 related to mental health or health screenings or environmental responses. Ensure that you're building your policies and procedures based on empirically based and scientific data. Use reputable websites such as the Arizona Department of Health Services and the Center for Disease Control to help inform these. And of course, remain informed of updates from our governor's office. Updates from our governor's office are up to date and can provide you the next step in how you update your policies and procedures specific to our state. Again, the adaptation of COVID-19 responsive policies and procedures help us to ensure continuance of services to our victims of human trafficking. The four main areas of focus that Streetlight USA has worked on in adapting our policies and procedures has been to ensure that we're remaining in communication and informed, ensuring the physical well-being of our staff and our clients, ensuring the emotional well-being of our staff and our clients, and remaining compliant. We, as victim service providers, will be here after COVID-19, and we need to ensure that we remain compliant and we continue to move forward, as COVID-19 will soon hopefully be in the past or something better managed. We will still need to continue to operate and provide services. I thank you on behalf of the Victim Services Workgroup for your time.